Hey there, Christian here. It is October 3rd, 2024. And recently, I have been involved in my place of employment's, it's a hospital system, their health equity committee, um, consulting, presenting um, on being transgender. And so I was first approached by the vice president of something within our system, and who had reached out to my director, and they had asked me if I would speak at this committee meeting on health equity, so like health equality for transgender people and my experiences being a transgender person, and things like that. Just kind of tell my story, experiences, and things as it relates to our hospital system. And so that was actually a couple months back, and it went really well. I was super nervous at my place of employment. Being transgender isn't something that I talk about. It's not something that I've ever personally said out loud or disclosed to my coworkers. There are a few people that have been like on my Facebook that obviously can see that because I do post about that, but it's not something that I have really shared. My first working environment there in the last couple of years was very toxic as far as anybody that wasn't, I don't know, like them. If you're not like, I don't even know actually, because I feel like they made fun of everybody, to be honest. They said there was a transgender dad who brought his kid in, and he's very loud. And I was sitting at the phones doing some work, and one of the coworkers said, hey, that sounds like Christian, and referring to the voice, or it was something like that. And I just kind of froze, like I didn't know what to say or do. And when you just sit there and you're just like what the fuck. And it was something I wanted to address. It just, I don't know, it's just really hard when you work in kind of like a smaller office environment, and I know it's just easier to ignore it, but they kind of, a lot of people have left the clinic because of the toxicity, and it's unfortunate. And so I had talked with a dad on the phone who was having some troubles with his child, and so I was talking to him as a nurse, and just asked, have you reach out to a therapist for your child? Sounds like that might be helpful. He was like, well, no, I'm afraid to, because I'm transgender and I don't want them to take my child from me. And it just like broke my heart, that people, feel that way, because you're transgender. And so I had told him, I said, well, I'm a trans dad too, and I totally have some of those same troubles, with some of my kids. And so it was a neat experience to be able to share that with him, to be like, I know where you're coming from. And I did reassure him that our behavioral health area, and there are many other areas of our hospital system that are very wonderful, very welcoming, affirming, supportive. And I thought that that would be, a good fit. And I thought that both he and his child would feel safe. And so I shared that. And so it was kind of after that that I just was really like, I've got to do more to just be helpful. I feel like I just live my life. Like, there was this transition that I went through, and now I'm just here and, living my life, being a very busy parent, and working, and, just doing your day-to-day thing, and being transgender or being an advocate for our community, the kids in our community, the parents of our community. It just it just takes a back seat. It just isn't there, and it's not a priority. But I think I have felt lately that it needs to be a priority, because there needs to be more of a voice, And so today I did a video for our healthcare system, probably to be shown at what I'm told is like meetings and advertising. And I can't even believe I said yes to it, because it's just, to put me out there like that is not me. It's just stay behind the door, But there's so many things I wish I could do differently, just even now, like having talked to the person, just like I didn't even say like my pronouns, and like I wish I would have said that. And when you're like introducing yourself, and it's just going to be a short 2-minute thing, and so it goes so quick. They'll edit all the 30 minutes, they'll condense into 2. And I think that there's a lot of work that needs to be done, and I'm hoping that I can be helpful in that. I know that, I've been here in this medical community because of the children that I've been raising for 14 years, and I've worked in our health community that long here in our specific institution half that time. And so, I really do want to be a voice, and try to help and see where we can, get to a place where voices are heard and people are validated, so that's what I was doing. But it's just so interesting. I afterward, I just felt this just surge of emotion, because I don't think that I've really thought about being transgender in a long time, to be honest, like what that really means. Because I, fortunately, I guess I just get to move about and, blend in, and it's just no longer the like issue or concern as it was for, years in the beginning. So you just get to this place where, you're just existing, and so afterward, I was really kind of emotional just driving home, because I feel like it just triggered just so many emotions about just, I guess, like in the beginning, or even some now, but like, just like access to healthcare and support, and understanding of people, and the fear that I even felt less than a year ago going to the emergency department, because going, to a healthcare facility to receive care is, I think, one of the most vulnerable things that I can do, because you get to see everything. You see every medication that I am on. You get to see every surgery that I've had. You get to see everything, and you'd like to think that people keep things confidential, but I have seen the other side of it, and I'm sure there are some places that are better than others, but, it's scary. And so I think just to really have some of those questions brought up, and you're like, gosh, I just really haven't thought about that. in a while. But I just lost my doctor that I've been seeing for 10 years here, who's been seeing me since before like the beginning of my transition process, before I started hormones. And then, every several months, 6 months for the first few years, and then yearly after, and she left because she can't practice medicine in this state like she wants to. And that's so unfortunate. It's left me with no doctor. And I really didn't even think about that much until last night, because I just thought, well, I'm sure my PCP will take over, for my testosterone. But, like, I haven't asked her yet. And what if she doesn't feel comfortable? That's what specialists are for and whatnot. And some of the other people that they recommended when my doctor left don't take my insurance, so I'd have to pay out of pocket. Another person may take my insurance, but they're located an hour away. So you're just like, that sucks. That really brings up, like, access to healthcare and things that's just a little bit more difficult. And then where the world is today is a scary place. And that's kind of what I said too. It's very scary. Just to think about how things can be compromised for me. So, it'll be a short PC video, and I'm sure it'll come out just fine. But it was very vulnerable, being opened up, and then just to think about how many people will see that. And, I began my transition here with children in the healthcare system. So really, there's a lot of doctors that I saw or still see, or that I worked alongside, during my transition, after, and I've still, seen them years and years later. But, there's probably a fair amount that don't. And then I talked to a lot of these doctors on the phone, or I messaged them. And so then to kind of have the whole organization know your personal stuff like that, it's very much outside my comfort zone. I've always been a work is work and home is home. If I make friends, great. We talk, great. But it's not something that, there's plenty of nurses that just air out all their dirty laundry to their patients or families or whatnot, and that's just never been me. So it'll be interesting to see where it goes, where I go with it. But it did spark a little fire inside to be like, okay, where can we take this next? Because there's work to be done. Where can I help? So anyway, just didn't expect to have like an emotional reaction. I expected to get that a little fired up, but the fired up too was kind of quickly extinguished, because I think that usually after something like that, I would call my mom and be like, my little scream, I did this, and just how it made me feel, and I would have some questions for her, like, as a parent of a transgender child now, and, being able to go through the last 10 years, and, like, what if I was a kid? Like, what would you ask a doctor, or what would you think you would need for support? Or, even though that's not something that they did when I was younger, but yeah, that's beside the point. It's just I didn't have that, so that then it kind of quickly became a little bit more sad, that I couldn't share that with my mom, since she's passed away 3 years ago. So it was really kind of stinks. But we'll kind of see where it all goes, and I just wanted to share that, with you, because it's just something new and vulnerable. So thanks for listening and stopping by. I appreciate it. Have a great one.